Hi, I'm Rick Pollack, President and CEO of the American Hospital Association. Thanks for tuning in to this special announcement. COVID-19 has changed life in our country in so many ways, but it hasn't changed our commitment to ensuring that all people, regardless of background or zip code, have equitable access to the highest quality of care. The AHA created the Equity of Care Award in 2014 to honor organizations that serve as outstanding leaders in eliminating healthcare disparities and promoting diversity and inclusion. Last year, we renamed the Equity of Care Award to the Carolyn Boone Lewis Equity of Care Award. Carolyn was the first African American and the first hospital trustee to chair the AHA Board of Trustees. She was a highly respected attorney who served as a trustee of a safety net hospital and was a tireless advocate for equity of care. It was an honor for me to have known her personally and to have worked with her. That's why I feel so privileged to be part of honoring her memory as a pioneer for diversity, inclusion, and health equity. We've seen how this pandemic is further exposing racial health inequities. So now, more than ever, we must recommit to address health disparities. Now, more than ever, we must harness our collective power to champion changes that will advance health for every American. That's why it's a great pleasure to recognize the winner and honorees of this year's AHA Carolyn Boone Lewis Equity of Care Award. This year's winner is Cone Health in Greensboro, North Carolina. Cone Health's comprehensive approach to health equity starts with a commitment from its diverse leadership to foster a culture of belonging. At Cone Health, physicians are required to participate in health equity courses, as well as receive unconscious bias training and education on racism. They have also successfully used race, ethnicity, and language preference data to design and implement programs that improve patients' health and reduce readmissions. Accepting the 2020 Carolyn Boone Lewis Equity of Care Award, on behalf of Cone Health is my friend Terry Aiken, Chief Executive Officer.
Thanks, Rick. You know, at Cone Health, we exist to connect healthcare and well-being for our communities. As part of that, we promise every day and in every interaction to be right here with all those we're privileged to serve. To do that, we must be committed to giving everyone a fair and just opportunity to be healthy, committed to respecting each other, honoring our differences, and creating a true sense of belonging, and committed to making health equity, diversity, and inclusion a top organizational priority. It is our privilege to make and renew these commitments every day. On behalf of our team and all those we serve, thank you very much for this exceptional and much appreciated recognition.
The Henry Ford Health System in Detroit is an Equity of Care Award honoree. This organization has a long track record in this arena, and its leadership has implemented a system-wide healthcare equity campaign focused on improving cross-cultural communication and integrating improvements into organizational practices. And their Institute on Multicultural Health is working to develop effective and innovative approaches to providing quality care to vulnerable populations. I also want to recognize Henry Ford President and CEO Wright Lassiter, who will serve as the 2022 AHA Board Chair, and Dr. Kimberly Dawn Wisdom, Chief Wellness and Diversity Officer at Henry Ford and current Board Chair of our Institute for Diversity and Health Equity. Thank you both, not only for your tremendous efforts on behalf of your patients and communities, but also for your leadership and your guidance to the healthcare field.
On behalf of Henry Ford Health System, I want to thank Rick and the American Hospital Association for this special recognition. I also want to congratulate Cone Health and Chatham Hospital for their honors and their work to advance equity of care. We are proud of our work at Henry Ford on diversity, equity, and inclusion, but we pledge to do more. We continue to enhance our strategies to meet the unique needs of the populations we serve and to improve their health outcomes. As the COVID-19 pandemic and racial incidents have shown recently, there's a clear need to address social inequalities with a greater sense of urgency to ultimately achieve equity in healthcare. We are committed to do our part.
Chatham Hospital in Siler City, North Carolina is also an Equity of Care Award honoree. This critical access hospital has shown that regardless of size, committed hospitals can lead the way in ensuring health equity. Chatham implemented staff education on cultural diversity and unconscious biases. In addition, the hospital is developing strategic partnerships with community organizations to create mentoring programs. Accepting the award on behalf of Chatham Hospital are two great colleagues, Chatham's President Jeff Strickler and Keith Stinson, Emergency Department Director.
Hi, I'm Jeff Strickler, President of Chatham Hospital. I'm honored to accept this award on behalf of Chatham Hospital. To ensure accurate data collection and disparity assessment, our caregivers leverage the collection of race, ethnicity, age, gender, and other data to educate staff on cultural diversity and unconscious bias.
These efforts, in particular, have helped the care of non-English speaking patients. We are committed to our community collaborations, which include a monthly free food pantry, working closely with county nonprofit programs to connect patients to services, and coordinating with local efforts to curb the misuse of prescribed opioids.
Congratulations to all. Thank you for your unwavering commitment to achieve a society of healthy communities where all individuals can reach their highest potential for health. I know your efforts will inspire others, and I encourage you to learn more about the incredible work these hospitals are doing to advance health equity. Please visit our Institute for Diversity and Health Equity's website to learn more.